is Tyler with Southern California EMS Training Institute. Today in this video we're going to be going over respirations and how to adequately assess the patient's respiratory rate. When we're looking at respirations, you guys are literally just assessing the patient's chest and the rise and fall of the chest. What we're looking for as we assess respirations are three things. We're looking for the rate, right? We're looking for the tidal volume, and then we're looking for the effort. We're looking for those three things as we assess for respirations. First off, we're going to be looking for the rate. We're going to be looking at how many times they breathe per minute. To do this, we're going to assess rise and fall of the chest. How often it happens, we're going to assess it for 30 seconds and multiply it by 2. A couple of different techniques is number one is look at the chest. Sometimes look at the lower part of the chest because it maybe moves a little bit more. Other things is maybe assess your patient's heart rate or pulse rate while you're assessing their respirations. So that way maybe the patient thinks that you're assessing their pulse rate instead of the respiratory rate. Patients will tend to change their breathing patterns if they know that you're looking at or assessing their respiratory rate. After getting their rate, knowing how many times a patient breathes per minute, we're going to move on to tidal volume. Tidal volume stands for how much a patient breathes in with one breath. All right, we want it to be adequate. Our patients are either going to breathe in full, or they're going to have a good full breath, or it might be shallow, where they're not getting a full breath at all. And so those are the two things we're looking for when we're looking at tidal volume. Are they getting a big full breath, or are they getting a shallow breath? In order to do this, again, we're looking at the patient's chest rise. Really the only way for us to assess tidal volume in the pre-hospital care setting. So that tidal volume, again, what we're doing is looking at the chest and trying to determine, is that a full breath of air or is that a shallow, small breath of air? And then lastly, we're looking for effort. Right? For our effort, we're looking, is my patient having an increased work of breathing? Are they maybe labored with their breathing, or are they unlabored? Right? Is this patient breathing really hard? Are they having a difficult time breathing? Or does it look easy and natural for them? Right? So hopefully a patient, when we're assessing their breathing, it looks like it's easy and natural and they're not having a hard time doing it. So again, as we're assessing a patient's respiratory rate, hopefully that rate falls between the normal ranges for an adult, which for your adult patients is between 12 and 20 breaths per minute. Hopefully, right, we're also looking for a good tidal volume of a full tidal volume, and then again, that patient's breathing non-labored, right? So we're looking for maybe 14 breaths per minute, appears to be full, non-labored respirations. That would be an adequate assessment of your patient's respiratory rate. This is Respirations with Southern California EMS Training Institute. Thank you guys very much.